Hello, I'm Lynn Onstot with the City of Joplin, and I welcome you to Joplin Insider. This show is designed to give you a behind-the-scenes look of different departments and programs going on at the city. Today, the show will be split into two segments, focusing on the city's health department. Our first segment will focus on the medical services, and during the second portion, we'll talk with Joyce Doty with the WIC division. Now, I'm happy to have Cynthia Burnham with me. Cynthia is the Medical Services Coordinator of the Health Department, is that right?
That's right.
Okay. Well, welcome. We appreciate you coming out today.
Thank you for having me.
Well, to start with, I'm not that familiar with the many medical services the Health Department provides. I kind of look at it, people use it when they need it, and ideally they probably don't need it, but maybe every now and then.
Right.
So, can you tell us a little bit, an overview about the services in the Health Department?
First and foremost, I think what the medical division is known for is our immunization program. Okay. And we can immunize all ages, insured and uninsured, and that's what we want to do, is get out there and prevent the diseases that the health department tracks. Communicable disease tracking and outbreak control is one of the things that we do, and that's the one that we really hope we don't have to do a lot of. But we're going to find out from the hospitals and physicians what communicable diseases are out there, and then we can work on controlling it and making sure it doesn't spread and putting a stop to that. Okay. We do STD testing and treatment for those who might need those services. We do pregnancy testing and can issue temporary Medicaid for pregnancy for a pregnant woman that doesn't have Medicaid yet but might need some coverage so she can get early prenatal care, because that's important for the health of the infant.
Okay.
We also provide vital records, birth and death certificates, and other documentation. And we play a role in emergency response, for instance, the tornado, things like that.
Yeah. Well, I know you guys are out there quite a bit giving out the immunizations or giving, tetanus shots out in the field. Right. And I think the quote was 17,000 shots, I think the stat was, something like that.
And I don't have a number because that was before I was with the health department, but I know I was one of them that received one, and it was certainly appreciated.
Yes, so, me too. Yes. Yeah, they came to us as we needed, and we appreciate that. So, well, like you said, the immunization program is one that we're probably all familiar with, that we know about immunizations and how important they are. So can you tell me about the different areas for the children, adults, and I know we run a flu clinic as well. Can you go over those a little bit?
I will. We have, like I said, all ages. The Vaccines for Children program has state-funded vaccines so that children who are uninsured can get those immunizations. And that's up to and including the age of 18. We also have a set of vaccinations called 317, which is an also state program for uninsured adults that they can get vaccines they might need. But we also carry vaccines for those people who have insurance and need a vaccination. It might be a travel vaccination, but it also might be a student entering college that needs an MMR, so they can come to us and get it under their insurance plan.
MMR meaning?
Measles, mumps, and rubella.
Right. I knew that as a mom, but some people may not recognize that. Yeah.
And we just want everybody out there to get vaccinated. They can call us, we'll get them in and get it taken care of.
So even if they have a question, if they're not sure, they can call you, they can look on your website.
Yes.
I know later in the show we were going to talk about the Joplin Health Department website, but I don't know if the control room could pull that up possibly, and we can show them the different sections of it. The flu clinic is another area that you do at different times. That kind of goes into what you said about the communicable disease tracking. Right. So is flu one of those that you track?
Flu is one of those. We don't do individual flu tracking, but any of the medical clinics, hospitals that test for the flu and get a positive A or B flu are going to send that number to us, and then we input it into a system so you can log on, not to our site, but through the CDC, and it will tell you what flu is out there and the numbers that are out there every year.
And again, when the doctors and the hospitals are reporting, they're not reporting names, they're reporting numbers of cases, correct?
Of influenza, yes.
Right. Again, we have the HIPAA rule that there's no information shared. I don't want people to think that, by sharing this information for record keeping.
It's just for us to look and see how we're comparing, how our the immunization for flu is based on a prediction, and they're going to look at it and say, we think this is what we need to hit on. That's what they'll try to put in that flu vaccine. And it helps us to know if they're accurately getting what we need covered.
Because I know a couple years ago there was a miss, and everybody talked about that, and that was a big deal. But that does happen. And
there are so many strains of flu.
I agree.
It's hard to
I think I've had a couple this year, as a matter of fact. So yes, I understand. So, well, you're serving all ages. Did we cover all the immunization thing? Did we talk about the children's? You mentioned that.
We have insured and uninsured. Cost involved at the health department is comparatively low because we offer, if it's a vaccines for children that has Medicaid, we can file for Medicaid. If it isn't, if it's an uninsured child and they use state-funded vaccine, it costs them $10 per child. So they're going back to school and they might come in and need 4 vaccinations. It'll be $10 to get all 4 of those vaccinations.
Right, and they, if they have several children, it's easy to go all at the same time, and
yes.
Yes. Now, do they need appointments for that?
We prefer appointments so we can make sure we have adequate staff and get people and they don't have to wait a long time. However, the clinic is open from 8 in the morning until we usually start shutting down about 4:30, and they can walk in. We prefer appointments, but if they walk in and they need a shot, we'll do our best to get it if we have a nurse available that can give it.
Okay, that sounds great. Now, we were talking about the children's. There are certain probably tests and areas that focus more on the adults, is that right?
Yes. We do STD, sexually transmitted disease or sexually transmitted infection, and we can test, right now we test for gonorrhea, chlamydia, HIV, and syphilis. Okay. And that's either a urine or a blood test, and they can schedule, they come in then, and we will do a little bit of, get information from them, see what risks are involved, do the testing if we need it, and then if needed and we get those labs back, we can do treatment as well.
Okay, so there's treatment and counseling along with that,
yes,
right?
Yes, so, and condoms are provided. So
yes, well there you go.
We can take care of all of that.
That's right. Now again, did you say there was a charge or? For that?
Not for STD testing, no.
It's free.
They just walk in and they have to meet guidelines for the state testing. There's criteria. And I won't get into that in depth. That's part of the interview process. We just find out if they qualify.
Sure.
There are places you can go in Joplin to get tested if you don't meet that state guidelines, but anybody that tests has to follow those state guidelines for testing.
Right, when I was going to say, and I'm sure, again, it's one of those personal interviews that you do one-on-one. And it stays with you, so that's great. Well, I know there's areas that people sometimes misplaced documents, and all of a sudden we might need a birth certificate or something of that nature. Can you guys help us out with that?
Yes, if you were born in the state of Missouri, it costs $15 to get a copy of your birth certificate or your death certificate. And all you have to do is come in with photo ID and we can get that printed. It takes probably 10 minutes to come in and get it right here in Joplin, so you don't have to mail off to the state and get that. If you were born outside of Missouri, call us and we can give you information and help you link to where you need to go to get that as well.
Okay, so $15, and is that per copy? I mean, if they need multiple copies?
Yes, per copy.
Okay, so and what information they provide, just their name?
They need to know information about the person they need the birth or death certificate for.
Okay.
And they really need to be somebody that needs that information.
Okay.
I'm not going to be able to walk in and get a birth certificate on you and find out your personal information. But if they have proof of ID and they're the parent or a guardian, or in the case of a death certificate, a spouse, then we can provide that for them.
Right. Well, and I know, unfortunately, that when my mom passed on the death certificates, you need multiple copies of those. And usually, again, the mortuary or wherever will provide those. But if you forgot one area or whatever, or later on in life, you find something else you need. So those are the kind of things, I get calls at the city about that. A lot of times about birth certificates specifically. Do you know, to get a marriage license, do they need their birth certificate?
Gosh, I don't remember if you do. I would think you do. I know if you've been divorced, you have to have a copy of your divorce certificate, so I'm assuming you have to have a copy of your birth certificate. Okay. I know you now do in the state of Missouri to get a driver's license as well.
Right. Well, that's the one that I was thinking of, is the Department of Motor Vehicles, DMV, requires that. Yes. So that's, when you get your insurance and things like that, they need all this information, and so that's good to know.
And we will help you out.
Right.
And we also do immunization storage of that. When I went back to nursing school when I was older, I had to really search to get my immunization records as a child. Okay. And so at the health department, we can put that into a state tracking system, and that's very helpful too. So even if you don't get your shots with us, you can bring in your child shot record and we will get a copy of it and put it in the state system for you, so no matter where they're at, what age, they can log into Show Me Vax and get that then. Well, that's a great idea, because sometimes I lose that record too, and even though my kids are getting older, sometimes it comes up, what are the records? So,
and I have to search and search or call the doctor's office again and ask
Right.
for that. So, well, I know I'm just kind of skimming the surface on the different areas of the medical division, but you know, if they want more details, is there a place they can go? Is there a website? I thought I saw it flash up on the screen, and maybe I didn't, but oh, there it is. So on your website, how do they find you specifically, or the medical division?
Well, they can go down on the left side of the screen and it will say divisions, and they can click on it, and then they go to the health department, and then beyond that, the health department is going to list our different areas, and they can click on medical, and it will tell about all the services that we provide.
Yep, that's what they just did. So yeah, that starts off with your mission and vision and who you serve, which is basically, you know, everyone from all ages, it sounds like.
And though our prices are kept really low, sometimes people do need to know what to expect to bring and what we want them to bring when they come.
Right.
And our phone number's always on there. They can call us, and our staff will do everything they can to help them.
Yeah, and that's 417-623-6122?
6122, yes.
Okay. I try to remember that. I think I get that confused with a couple other numbers at the city.
Very well.
Yes. So, well, is there anything else that I haven't hit, or areas that we want to make sure we focus on?
Only one smaller thing. We also, under the Community Health Collaborative that the health department's a part of, have a website called LiveSmart, Southwest Missouri, livesmartswmo.org. And we do events, recipes, healthy articles on that website, a list of trails in the area on the website. We have a list of smoke-free restaurants in Joplin and Jasper County and the surrounding area, Newton County. They can get on there if they want to go to a restaurant that's smoke-free, or if they want to find out about running events, 5Ks, things to do with their kids for the weekend, trails and hours. It's a really helpful website that I help to maintain, and one that we're really proud of, so I'd love to have people visit that.
And it's linked from your website as well under the resources,
yes,
is that right?
It is.
So if they can't remember the website, they can go to your website and find it. I mean, everything's on the web. If you don't need anything, there it is. They called it up. I know I do use that because it does have a lot of good information on there, so I do appreciate it. Well, that kind of wraps up a little bit of the Medical Services Division. I do appreciate you coming out and sharing some information with me.
It was fun to be here.
And with our viewers, of course. Well, this concludes this segment of the Joplin Insider. Next, we will have Joyce Doty with the Joplin WIC program, so I hope you please stay tuned.
Hi, my name is Corey, and I'm a math tutor at the Student Success Center at Missouri Southern State University.
Hi, my name is Sam Miller, and I tutor biology and general studies here at the Student Success Center with Missouri Southern State University.
Hi, my name is Juliet Smith, and I'm a math tutor in the Student Success Center at Missouri Southern State University.
Hi, my name is Ben Starkey. I'm a math and physics tutor at the Student Success Center at Missouri Southern State University, and I'm here to help you succeed.
Located in room 301 of Hearns Hall, the Student Success Center offers a variety of services to help you succeed. Students at Missouri Southern can receive tutoring in many subjects, including math, writing, and biology, all free of charge. The Student Success Center also offers student disability services for disability accommodations, the tutor training class, and the college academic skills class. The Student Success Center at Missouri Southern State University, assisting students in becoming more independent, self-confident, and efficient leaders since 1984.
Catch episodes of Window on the World only on KGCS-TV Channel 22. Join us as we discuss the experiences of students who have studied abroad and learning about the cultures of international students studying at Missouri Southern. Students have the opportunity to travel to England, France, Ireland, Spain, Japan, and many other countries through faculty-led trips or a semester abroad. For more information about Missouri Southern's international mission, please visit the International Studies page on mssu.edu. Window on the World, only on KGCS-TV, Channel 22.
Hello again, I'm Lynn Onstot, and if you joined us earlier, you learned a little more about the medical services of the Joplin Health Department with Cynthia Burnham. Next, we're going to visit with Joyce Doty, coordinator of the Joplin WIC program. Both are under the health department, so I'm glad to learn more about a division that or a department that I don't know much about. So welcome, Joyce.
Thank you.
I appreciate you coming out and telling us a little bit more. First off, we use the acronym WIC with everything. So can you tell me a little bit, about the WIC program? What does WIC actually stand for?
WIC actually stands for Women, Infants, and Children. So we're serving women that are pregnant, breastfeeding, or postpartum, and then infants, and then children up through their fifth birthday. Once they turn 5, then they would no longer be eligible for our program.
I didn't realize it went that long. That's
Yes.
great. So, and it's it's run through the state, is that, I mean, as far as the funding sources?
The funding source actually is it's federally funded, then it comes to the state level, and then the state disseminates it out to each county based on caseload.
Yeah, the need in the area, right. So, well, it sounds like a great program. So how does someone qualify for a program like this, and what do they need to do to receive these types of services?
Sure. Things that they would need to do is typically they have to have a medical or nutritional risk, and we're going to do that by doing measurements at our office and asking them some nutrition questions. And then to actually get on the program, they need to call or they can walk into the office, and they would need to bring proof of income, proof of ID, and proof of residency.
Okay.
So if they'll bring those with them, then we can try and service them that day, because we're doing a lot of our stuff on a walk-in basis, very few appointments.
So if they bring those 3 items, proof of income, proof of residency, and
proof of ID.
ID. Well, yeah, I would think most time people carry their ID, but I guess some people don't.
Well, but we also would need it if they're putting a child on. We would need a shot record or birth certificate for the child for ID.
Okay.
The residency is going to be some type of a bill that they receive in the mail. With
Like
that
a
current
utility bill.
Correct. With that address on it within the last 30 days. So if it's over than 30 days, we wouldn't be able to accept it.
Okay.
And then their proof of income, if they receive Medicaid or food stamps, they automatically qualify for our program. Otherwise, we need a month's worth of checks for whoever is working in the home in that household.
Okay. Okay. So a lot of this is some specifics to get started.
Correct.
So if you have questions, you can always go to the website, and I think we have that website that we'll call up either now or later on in the show. We'll point that out, but I think it's very easy to find. It's on the Joplin City web. Yeah, there it is, WIC, joplinmo.org /WIC, W-I-C. So easy to find, and it kind of walks you through the process and where you're located and things. So what specifically should clients know about WIC and some of the services that you offer?
Basically what WIC is it's a supplemental food program. It provides nutrition education and breastfeeding support. And we also refer to other community programs in the area. So in other words, they might be new to the area and they don't have a doctor yet, so we can give them a list of suggested doctors that are in the area, maybe connect them with Early Head Start or Parents as Teachers, or lots of different programs that we have in the area. So we're doing community referral with this too for whatever services that participant might need.
Well, that sounds great. Those community referrals, I know I use Parents as Teachers, and I thought it was a great program. If someone's not on WIC, can they still call for those types of referrals?
Sure they can.
Okay.
We can get them that information
so you're
and provide them
basically an early child care provider, a resource, I guess I should say. Yeah, not provider.
But resource, yes.
But you are a provider as well. So, well, I know you have a variety of different staff positions there. So who all works at WIC, and what kind of positions are there? What kind of services are they providing?
Okay, well, we have the clerical staff that are going to basically check in the participant to the program, kind of check to see if they have all the qualifications, talk to them on the phone, those type things. And then we have certifiers, which are doing the heights and weights and measurements of the children and doing some basic nutrition questions. And then they meet with the nutritionist, and the nutritionist then goes over more specifics for them. So our nutrition staff is knowledgeable about prenatal nutrition, postpartum nutrition, and breastfeeding nutrition. And they also have information on feeding infants and toddlers following My Plate. So
okay, tell me about My Plate.
The federal program,
okay.
My Plate.
Okay.
So www.myplate, and then you can get more information there on those specific things.
Okay.
But you can also get that information from us
because the diets do change, whether you're prenatal or postpartum. It depends. And if you're breastfeeding, you need more liquids. I know that's when I really started drinking a lot of water. I remember that. They said push water.
You're going to burn more calories then. So
yeah, it helps you lose your baby weight. I do remember that.
That's right.
So it's a good thing. So, so where exactly is the health department, and how do we get there?
It's located at 321 East 4th Street in the upper level.
Okay.
And as you come in that door, the medical division, which you talked about earlier, would be to the left, and we are to the right.
Okay. Easy to find.
So just divide up and come over to our side.
Here's the area with the smaller chairs. I've noticed that for the children. I'm laughing. I'm teasing.
I don't know if there's any smaller chairs over there or not.
Aren't there like little children's?
There's a little children's play area.
I guess.
Yes,
that's what I should say.
Yes,
the children's
there is.
area.
There is.
I was thinking smaller chairs like the library, but it's not. So.
And then we also have IBCLCs on staff in the office, which are International Board Certified Lactation Consultants that are going to help with breastfeeding. So we have lots of information there for the breastfeeding moms.
So. There's also a support group, but so you can come into the office and get a lot of this information.
Correct.
Now, is it a walk-in or do you need appointments for these types of things?
Most of them are done on a walk-in basis on Monday, Tuesdays, and Wednesdays. Thursdays and Fridays, we don't do quite as much there because we also have a satellite clinic that we run out of the Jasper County Health Department in Carthage. And we run it over there out of that office from 8:30 to 4:30 on Thursdays and Fridays. And it's usually the first 3 Thursday Fridays. But if you want to be for sure when we're over there, you need to give us a call, because there are some days that we don't go over there because they may have a holiday that we don't have at the city. And so we have to kind of fluctuate around when they have their holidays.
So it's basically the same services, but just a different geographic location.
Correct, because it's the same staff.
Okay.
We send staff from our office over there to take care of the participants.
So if you live in that area, you're in the
Correct.
county, you live in that area, you don't want to travel, you can't travel for whatever reason, there's a nice convenient location.
Correct.
So I don't know where the health department is in Carthage.
It's at 105 North Lincoln.
Okay, is that near the square or?
It's off of the square.
Oh, okay. It seems like everything's off the square.
Lincoln and Central.
Oh, yeah.
So,
yeah.
if that helps
it
any.
helps me. I don't know. If you don't know, you can always Google it, so to speak, because everything's on the web, right?
Right.
So I'm hitting some of the highlights of the WIC program, but I'm sure there's a lot more to it than what I've discussed.
Well, you'd hit on about the breastfeeding, about support group for breastfeeding, and we do have community breastfeeding support group. It's called Chi-Chi Mamas.
I love that.
And it meets the first Thursday of every month at 5 o'clock at the health department.
The first Thursday.
First Thursday.
Okay. At 5 p.m. What takes place at a support group like that?
Support group meeting, they're going to have some of the peer counselors that we have at the office. They're going to have one of the IBCLCs is usually there at that meeting. And then we also can have community people that might be there giving them some information on breastfeeding and just to support them to say, hey, you're doing a good job, continue what you're doing, because sometimes that's just all the mom needs.
It's stressful. It can be stressful.
Yeah.
So, yeah, because there's a variety of different issues you can run into, but easily resolved if getting some help. So, so if people want more details, we talked about the website, and they can call you as well.
That's correct.
What's your number?
It's 623-1928.
Okay.
And be sure you leave a message if we don't happen to answer, because we will call you back.
Okay. And up there is there's the phone number, and then they had the website as well. Well, and I know on WIC you guys do a lot of appointments. You know, I mean, you get settled into the appointments, right?
Right.
So I get those calls at the city that somebody called me from this number, but you can't leave a message necessarily because, again, it's a healthcare provider. Is that right? That's what someone told me, that you can't leave a message that you're calling them. No?
Oh, we usually can leave there are some rules, but typically if you've called me, I'm just calling back and saying this is the WIC office.
Okay.
Can I help you?
Yeah, okay.
And they could always say, we don't have anybody here.
Yeah.
And we could say, okay.
Okay. Okay. So that's what I was wondering. So, because when I said, well, I didn't understand it that way, but I wanted to clarify that. So you do leave a message if they're gone and reminding them of their appointment or something.
Well, we're just typically saying you called us, call us back.
Oh, okay. Sounds good. That sounds like a perfect thing. So there was something else that popped in my head. Oh, well, I know with the food program and things like that, there's different things that are kind of important to remember when you go to the store, to buy the specific items. Is that right?
Well, yeah, the things is basically on their they get a WIC check, and on that check it's specifically what they can get, and you're going to want to put it on the conveyor belt at the store in the order that it's written on that check so that they can check it through much easier. And then they have a food list that has the pictures of the items that they can choose from at the store to fit into that.
Makes it very convenient because if you're going to the store, I mean, with a young child and depending on the age and how active they are, that it can be kind of hard to get through the store in a quick and easy manner.
Sure.
So that is nice that you have that all wrapped up into one segment. So, well, is there anything else that you'd like to share? Something I missed?
Not that I can think of. I think we covered all of it.
Okay, so you have a great staff. I know you do a lot of different clients that come through. How many? Do you know your number these days?
We're running about 3,400 a month.
Wow, that's a lot of moms and babies coming through. Is it okay for them? I mean, obviously in the breastfeeding and things like that, they're probably bringing their children. But for the younger, if they're just coming in for a postpartum, if they can get a sitter, would you prefer them to have a sitter? Do you want to see the child?
It's really what works out for them, because a lot of times we may need to be seeing the child for something else anyhow.
Oh, okay.
So usually they're going to bring the child with them, but they don't have to. And we're usually telling them when they definitely need the child to come and when they don't actually have to be there.
So you kind of spell it out for them and give them direction, and
we try very closely.
Yeah. Well, that is nice, because again, when you have your first child, it is nerve-wracking at times. I'll be the first to say there's times that you just don't know what to do for different reasons. Yep. So if someone has a general question just about their child care, and they're in the WIC program, they can call you as well, because I know you're a certified nurse as well. I'm a registered nurse, pardon me. Yeah,
dietitian.
Dietitian. Oh, okay. Yeah. So, I'm sorry.
That's all right. Registered dietitian, nutritionist.
Okay. And then you have nurses that work.
All of my staff are dietitians, except for the certifiers.
Okay.
So,
well, I'm learning.
The nurses are over on the medical side. So if you need to see them, check in on the medical side.
Okay. Well, that helps me. So WIC's the nutrition side, Cynthia's the medical side.
Correct.
We got it covered. So that sounds great. Well, I do want to thank you for coming in today. I appreciate you sharing the information. I know I learned a few things. I hope our viewers learned a few things. Again, if you have any questions about our health department or the WIC or the medical services, please feel free to contact the city or myself. And again, I appreciate you watching, and I hope you tune in next time. Thank you.